So once your baby is born, a lot happens very quickly. And a lot of parents don't realize what's happening until they're asked to sign a consent or you've got a whole bunch of people at you. So in this episode, we'll walk you through the important things you need to know while you're in the hospital and in the first 24 to 48 hours, ideally if you've had a term baby, right? So welcome. This is a Dr. Amaka Namani show where we are all about preparation over perfection. Right, so at this point, you've gone to hopefully all of your OB visits and you've gotten your Tdap, which protects you protects you and the baby. And if it's flu season, you would have gotten the flu vaccine. And again, if it's RSV season, usually within 32 to 36 weeks of your pregnancy, you would have gotten that as well. And so it's time to have the baby, and you've had the baby. Congratulations. And then a whole lot of things happen, right? And in those first few minutes, the first thing, if your baby is stable, is that we usually recommend skin to skin. Whether you choose to breastfeed or not, this is so important for you and for the baby, the immediate bonding that happens in those first few seconds of life, right? And then cord clamping, and again, just if your baby is stable, getting the first vaccine that I actually really say is breast milk, right? Which is really thick and loaded with antibodies that protects your baby and coats your baby's abdominal walls with breast milk and all of the antibodies that you have so amazingly passed on to your baby. And then again, this is for babies who are generally stable. We usually want to get the baby's vital signs, and the APGAR scores usually happen at 1 minute and 5 minutes based on your baby's tone, reflexes, heart rate, and a couple of other important vitals. And then you obviously, every mom wants to know, how much does my baby weigh? How much does she weigh? How much does he weigh? How long is he? How long is she? And how big is her head, right? So these are some important things that will happen really in those first few minutes. And just even prior to this, especially in my state of Pennsylvania, starting in 2026, doula support will begin to be covered. And that's something I would strongly recommend if you're able to, is to get a doula, even if you have a support person, because a doula is specifically trained to do these things. And hopefully at this point, you would have had some important classes that I recommend in the prenatal period, tops of which are infant CPR, breastfeeding education classes, and birth classes, right? So at this point, you've done skin to skin. You now know how much your baby weighs, and skin to skin again actually does help with temperature regulation, right? And then they usually take the baby from you for a few, depending again on the hospital where you have the baby, a few other things always typically happen actually in most hospitals, which is the erythromycin eye ointment, which protects your baby from gonococcal and chlamydia eye infections. And it's something that we always recommend as standard. Your baby will also get the vitamin K shot, which protects your baby from bleeding. Girl or boy, and especially in boys if you choose to circumcise your baby, and then your newborn hepatitis B vaccine. And yes, as a pediatrician, I am 172% for the newborn hepatitis B vaccine. It's unfortunate that in these times, it's almost become a thing of controversy, but it shouldn't be. The hepatitis B vaccine is very important with protecting your baby from this virus. The vaccine allows your baby's body to fight an infection in the case of one faster than the virus could replicate or multiply. And for babies who do not get the hepatitis B vaccine, can have chronic liver disease, which can lead to death. So it's really important that you get this really in those first 24 hours of life, right? And so after these things are done, then a lot of times you are giving your baby to breastfeed if you choose to. And honestly, if you choose not to breastfeed long term, I strongly recommend getting giving your baby the first milk, which is the colostrum, which we've just talked about, but really breastfeeding as much as possible. And most babies will cluster feed. Yes, that is absolutely okay. Your baby will feed 10, 12 times, and there's nothing wrong with your baby or you. Babies lose up to 10% of their birth weight. We usually don't want them losing more than that. So prior to discharge, your baby will also get a congenital heart disease check, which basically makes sure that your baby's heart is nice and healthy. Your baby's bilirubin level will also be checked, which is usually just a heel stick. It's a prick, not an actual blood draw, and most babies do very well, as well as a newborn metabolic screening, which allows the state to check for the most common metabolic diseases. These things happen importantly, and if your baby is less than term, a lot of times less than 37 or 36 weeks of gestation or of birth, you will usually get a car seat education. And again, depending on the hospital, some hospitals may just offer this. But like we talked about in our first episode, you will not be discharged without a car seat. So it's important that you absolutely have this ready and good to go. And then, most babies are normally okay, after checking. And of course, at this point, your Group B strep would have been checked prior to delivery to make sure that you don't pass on any infection to your baby. Now, everything we've talked about happens in a very supportive environment in the hospital, right? But the real question becomes when you get home. What happens in the first night? How do you know your baby's feeding okay? How do you know she's breathing okay or he's breathing okay? How do you know the number of wet diapers he should be making or she should be making? How do you know the circumcision site is not looking crazy, right? And these are all the things we'll talk about in the next episode. So be sure to subscribe, share this episode with a friend, and we'll see you on the very next one. Thank you. Bye. Hi! Before we go, here's today's Mommy's Milk Moments, taken from Ziora's Quest, Mommy's Milk Rocks. That mom sure looks tired. Kinda like my mommy, I whisper. Did you know that a newborn baby breastfeeds 10 to 12 times a day? That's a lot. It sure is. And it's also true. Babies' tummies are so little and breast milk is so gentle on the tummy that it gets digested, they pee, poop it out, and they're ready for more. So here's your reminder to rest, drink a lot of water, and be ready. But I know you got this. So until next time, bye.